because they were busy looking after Albertans and caring for them at a critical time in our healthcare system. Let me add, just as a note, I know that at Christmas time, many folks from the Muslim, Jewish, Hindu, Sikh, and other communities step up to take extra shifts for some of their Christian colleagues who are observing their Christmas traditions. And I want to say a special shout out and a word of gratitude to them for what they've done. These are just some of the ways that the many sacrifices that these folks have made for Albertans throughout the pandemic. And my respect and appreciation for all of our healthcare workers goes out to each and every one of them. I also want to recognize the many Albertans who followed the rules and kept their gatherings small over the past week or so. Hard as it may have been to challenge our well-established plans, especially after missing out on traditional Christmas last year, I believe it will have made a difference. Even if it may be challenging to see that difference in the current rising case numbers that we have been seeing, the reality is that every little bit helps to limit a spread. And I want to thank people who have made sacrifices to do so during these holidays. By reducing the number of in-person social contacts that you have, you're helping to break the chains of transmission. And this is more important than ever, given how extremely transmissible the Omicron variant is. Alberta Health Surveillance Team is going to finalize exact numbers for the last several days, and they'll be posted online tomorrow. Dr. Hinshaw will provide some ballpark estimates in just a moment. But today I can share with you the approximate number of cases confirmed over the last 24 hours, which is about 1,400 identified from around 6,500 tests. That puts our positivity rate at approximately 22% province-wide. I know it's much higher in Calgary, and that is 100% higher than just a week ago, and 450% higher than the 4% average positivity rate that we saw through much of December. These preliminary numbers illustrate how quickly the Omicron variant of COVID-19 is spreading. And we see that right across Canada and around the world. I just saw headlines about 180,000 cases reported yesterday in France and over 100,000 in England. While this is not the news that any of us hoped we would get to start a new year, we are in a better position today than we were at the start of any previous wave of COVID. For one thing, nearly 90% of Albertans aged 12 and older have received at least one dose of vaccine, 85% a second dose, and the number receiving third doses continues to grow by the hour. We also have a strong supply of vaccine for anyone aged 5 years and older, and booster doses for Albertans aged 18 and over. When we were dealing with the second wave this last year, vaccines had just arrived a year ago, and only about 6,700 doses had been administered in the province last Christmas, and we were scrambling to get more from Ottawa. Today, more than 7.5 million doses have gone into the arms of Albertans, and more doses are waiting for those who are eligible. Booster doses are available for all Albertans 18 years of age and older, 5 months after they received their second dose, and indeed I got my third jab just last week. I'm pleased to see that despite the holiday rush, thousands of Albertans have made getting their booster doses a priority. As of December 26, at least 20% of Albertans who have received their second doses had also received a third dose of booster shot. This puts us, I think, second only to Saskatchewan amongst the provinces in reported third dose administration, which is good news. And over the next 28 days, nearly 200,000 Albertans have booked appointments for their boosters, but only about a third of the booster shots that we administer are pre-booked appointments at AHS venues. About 2/3 are going through pharmacies, so we actually think the numbers are much higher than what we're able to report. There's a bit of a reporting lag before we'll know exactly how many have been administered through pharmacies, but we are making important progress, and that is critical. Please, if you have not yet stepped up and you're eligible for your booster shot, get it now. I'm also pleased to say that there has been a tremendous uptake in the rapid testing kit rollout. To date, about 800,000 5-pack test kits, which means about 4 million individual tests, have been shipped to pharmacies and AHS sites and distributed to Albertans. That's in addition, by the way, to the, I think, 7 million tests that had previously been administered, particularly to higher-risk populations like staff and residents of long-term care facilities, people in the healthcare system, schools in outbreak, etc. I'd also like to thank our pharmacy partners and AHS employees who have been working hard to get kits into the hands of Albertans. And I appreciate every Albertan who's picked up a test kit for themselves or on behalf of a loved one. I know that many of those kits were used by families to do a quick test before visiting with elderly relatives over the holidays. That's certainly what I did. Despite these advances, the situation we are in today is very challenging. In addition to reducing the number of people who we come into contact with, the most powerful thing we can do is, as I say, is to get vaccinated. This will decrease our risk of being infected or infecting others, getting seriously ill, requiring hospitalization, or dying from the severe outcomes that COVID-19 can cause. And I'd like to pause to address some confusion on this point because people have remarked that there appear to be a growing number of so-called breakthrough infections of people who've been vaccinated who are getting the Omicron variant of COVID. And while that is true, it's also true that very, very few vaccinated people are ending up with severe symptoms or being hospitalized. That data is clear in countries that have been hit hard and early by Omicron, like South Africa, Denmark, the United Kingdom, and many other jurisdictions. I saw a report from an Ontario physician, Dr. David Jacob, the other day, who said that after a long shift in an Ontario hospital, he did not see a single COVID patient who had been vaccinated being admitted for care. So please understand that while transmission is possible for people who are vaccinated, the chances of hospitalization are radically lower than those who are unvaccinated. And that does concern me. It should concern all of us because we continue to have in Alberta about 360,000 eligible people, adults, who have not yet received a first dose. That doesn't include 5 to 12-year-olds, but amongst adults and amongst seniors, we still have about 50,000 over the age of 65 who have not yet received a first dose. I'm very concerned that those people are particularly vulnerable to the Omicron variant. Getting vaccinated will also go a long way to spare our healthcare system and our hardworking healthcare workers from the stress and pressures of this wave after the 22 very difficult months they've already been through. So if there's a dose you can get, whether it's your first, second, or third, get it booked today and go into 2022 with a greater sense of confidence and protection and care for our healthcare system. It's almost hard to believe that it's nearly New Year's Eve. This has been another long and hard year for everyone. In one way or another, COVID-19 has touched the lives of every Albertan, just like everyone around the world. And that's why it is up to each one of us to do our part to help stave off the potential worst consequences of this fifth wave. And on this, I know people are seeing encouraging early data that the Omicron variant is significantly less severe than earlier variants of COVID. But we also know that it is hugely transmissible. We are seeing and experiencing that in Alberta right now. And so if the numbers reach an unmanageable high, even a very small percentage of those people requiring hospitalization could be enough to challenge or overwhelm our healthcare system. So please take this very seriously. I hear a lot of people just dismissing this as the common cold. It is nothing like that in terms of its severity and certainly not its transmissibility. Please take this very seriously. I know that's the last thing any of us wants to hear at this time of year, but it's the cold, hard truth of what's required for the situation that we are in. We must once again band together and do the right thing to slow the spread of COVID-19. Tired of all of this as we may be, it's what we need to do. So as you finalize your plans for New Year's Eve and the rest of the holiday season, I urge you to reconsider your plans in light of the situation that we find ourselves in now. Follow the restrictions in place and please don't look for loopholes. Keep your gatherings small and don't congregate with more than 9 other adults. Get the vaccine dose you're eligible for and utilize one of the free rapid test kits available. I know the demand for rapid tests has gone through the roof, and I'm pleased to say that the first million rapid tests of the 10 million that we've purchased directly as a province will arrive this week. Another 3 million will arrive next week. And once again, we hope the federal government will accelerate approvals of other rapid test kits so that we can have more supply. We'll make these tests available to everybody through pharmacies and Alberta Health Services sites. So please keep an eye in your communities on when you can get those new tests. And finally, please reduce your in-person contacts by at least half and do everything that you can to break the chain of transmission in this fifth wave. Thank you, and I will now turn it over to Dr. Hinshaw in Edmonton for her comments, and then we would be happy to take media questions.
Thank you, Premier, and good afternoon, everyone. Today, I will provide an update on COVID-19 in our province over the holidays. I'll be sharing approximate numbers as our surveillance teams are still verifying the exact figures, which will be posted to alberta.ca tomorrow with a complete update. What this means is that the numbers today are estimates, and they have not gone through the rigorous quality assurance processes that our teams use before updating our online dashboard. That process will be completed before the update is posted tomorrow, so the numbers may change slightly. I know that we've all been used to regular updates on COVID-19 numbers, and it can be hard to wait. But I also want to emphasize that every province in Canada has adjusted reporting over the holidays since our teams have been working for almost 2 years straight, and their ability to take a few days off is a critical way to express our appreciation for their hard work. Before I get to the numbers, I want to clarify some questions I've been getting about the use of rapid tests for those who have symptoms. First of all, I want to be clear that if someone has symptoms like a cough, runny nose, sore throat, or fever, they should stay home and away from others. At this point, with the transmission we are seeing in the province, these symptoms create a high likelihood of COVID-19. If this individual has a rapid test, and if that test is positive, they would only need to get a confirmatory PCR test if they live or work in a setting like continuing care, correctional facilities, acute care, or shelters, or if they have risk factors that make them eligible for antibody treatment. These risk factors are listed online. Others who have a positive rapid test, including children who have no medical risk factors, do not need PCR confirmation. What is critical to understand is what to do if you have symptoms and a negative rapid test. Rapid tests are not as sensitive as PCR tests, which means that if you have symptoms, you should stay home and away from others until you feel better, even if you have multiple negative rapid tests. Please do not spend time with others if you're feeling sick, no matter what a rapid test result shows. And if you're sick and you're in one of the high-risk groups I mentioned earlier, it is best to go straight to booking a PCR test, as it will be more accurate in diagnosing COVID than a rapid test. Turning to the numbers, on December 23rd, approximately 2,000 new cases of COVID-19 were identified, and about 11,500 tests were completed. On December 24th, approximately 2,500 new cases were identified, and about 11,500 tests were completed. On December 25th, around 1,600 new cases were identified out of 7,200 tests. On December 26th, we had approximately 750 new cases out of about 4,000 tests. And yesterday, as you heard, we had approximately 1,400 new cases identified out of 6,500 tests. Our positivity rate over the past 5 days has ranged from around 17% to 22%. And as you heard earlier, we have never before had a higher positivity rate than just over 13% in any of our previous waves. This is one more data point that reinforces that Omicron is different from anything we have ever faced before. In Calgary and Edmonton, about 1 out of every 3 people going for tests is testing positive. That is why anyone who feels ill at this point should stay home and away from others until they're feeling better. Altogether now, we have about 15,000 active cases in Alberta that we know of. This does not take into account those who have not been tested or those who may have tested positive on a rapid antigen test and are following our guidance to free up PCR capacity for others by not going for confirmation. Despite this spike in our new cases, our hospitalizations are remaining relatively stable at this time. However, from previous waves, we know that hospitalizations are a lagging indicator and that today's cases will take time to reflect in any acute care numbers. In our fourth wave with Delta, we didn't see a steep increase in ICU admissions until about a month after our cases began to climb sharply. What this means is that we will not know the impact that Omicron will have on our acute care system until later in January, but the trajectory for that is being set right now. We will likely see hospitalizations rise in the coming weeks due to the exponential growth of the Omicron variant in our province. While it seems from other countries that have had more time with Omicron that there is a reduction in severity, the degree to which this happens is not yet clear. Even if it causes a lower risk of serious illness for an individual to be infected with Omicron, there could still be a significant impact on our hospital system due to the substantial rise in cases. The problem is we simply don't know, and our opportunity to slow case growth is right now. We will not have information on any deaths reported over the holidays until tomorrow's update, but I would like to extend my sympathies to anyone who's mourning the loss of someone they loved, no matter the cause. Navigating grief can be even more challenging during holidays, and I want to remind you that there are resources available 24/7 at ahs.ca Help in Tough Times or by calling 811. You are not alone, and help is there when you need it. I know that all of us are sick and tired of having to think about COVID-19. I would not ask us to continue to do so if it weren't still important. We cannot stop Omicron, but we can slow it down, and that means making choices every day to keep transmission as low as possible. This includes getting our vaccines, whatever dose we are eligible for, and whichever type of vaccine is available to us first. I have now received 1 dose each of AstraZeneca, Pfizer, and Moderna vaccines, and I want to reassure Albertans that using vaccines in this way is safe and effective. I would like to be clear that Pfizer and Moderna use the same mRNA technology, and both offer a high level of protection against COVID-19, particularly against severe outcomes. In fact, some evidence shows Moderna may be even more effective, and I encourage all Albertans to take advantage of whichever vaccine is available to them, rather than waiting for their preferred brand to be available. In addition to getting our vaccines, as the Premier mentioned, it's critical right now that we follow the restrictions in place. Given the busy nature of the season, I want to remind Albertans of the additional restrictions that went into effect last Friday for businesses and venues participating in the restriction exemption program. Please read the materials online about these changes to see the details and to make any necessary adjustments in your place of business. I also want to be clear that the restrictions apply to New Year's Eve parties that might be held at community leagues, halls, or other similar venues that are serving alcohol or food. I want to acknowledge the staff, operators, and owners of REP establishments for once again adjusting to the change in restrictions and following them to minimize the spread of COVID-19. If you go to any of these venues, please follow the rules and respect the staff who are simply trying to do their job and keep everyone there safe. After another year of working diligently to limit transmission and protect one another from COVID-19, I know that seeing Omicron arrive is a frustrating development. It proves that despite our best efforts, the virus continues to pose a threat, and there is still work to be done to conquer this both here and around the world. That's why I urge Albertans to keep their circles small and in-person social interactions low as we head into the new year. While the maximum for indoor gatherings is 10 adults, The smaller the gathering and the fewer get-togethers you attend, the better. Be sure to stay home or cancel if you're feeling sick or have any of the COVID symptoms, including sore throat, runny or congested nose, cough, fever, or loss of smell or taste. As we move through the last few days of 2021, I ask you to take time to focus on what really matters to you. For me, this includes family, friends, and the communities that I'm a part of. I encourage all of us to reach out to let people know we care about them and to think of ways that we can support them for all of those who need a lift right now. The next few months will be challenging, but we can and will get through this. Thank you, and we're happy to take questions.
Thank you, Dr. Hinshaw. We'll now move over to our media Q&A. Operator, can you please put through our first call?
Thank you. Don Braid, Calgary Herald.
This is for the Premier. In Quebec, there have been a huge number of cases, obviously 12,000 cases. And the health minister in Quebec, Mr. Dubé, said that today that there are some 10,000 healthcare workers expected to be off because of COVID protocols or illness with COVID. And that the government of Quebec is going to, because of the extreme shortage of workers that they're expecting, to allow workers who are infected with COVID to treat, apparently, others who are suffering from COVID. In other words, infected people will be treating infected people. I want to ask you, how serious is our crisis with shortage of healthcare workers because of sickness with COVID and people being off of COVID protocols? Do you anticipate any kind of action like this? And perhaps we could also hear how many workers are off because of COVID protocols or illness, and how many workers, out of what total of workers, please? Thank you.
Yes, thanks, Don. You flag a very important, I would say, central concern about Omicron, which is, given its infectiousness, we expect that it will require isolation of a significant and growing number of the healthcare workforce. We've seen similar concerns reported out of the United Kingdom and elsewhere. Other jurisdictions hit hard earlier on by Omicron. Quebec is probably a couple of weeks ahead of the curve relative to Alberta, so we have not yet experienced the same kind of widespread impact that Quebec has. We just had a meeting of the COVID Cabinet Committee earlier this afternoon, and I did not hear a report from AHS, from Dr. Yu, about this being an immediate, current issue. I will note, however, Don, that on December 24th, AHS did modify their protocol with respect to the vaccination requirement for healthcare workers. There had been some provision allowed for understaffed regions, mainly in rural areas, to permit unvaccinated individuals to do frequent rapid antigen tests as an alternative to vaccination, because laying those people off would have compromised the ability to deliver care in those regions. So that policy was modified on Friday to allow for a province-wide negative antigen test option to address the anticipated shortfall in the workforce as a result of Omicron infections. I don't have the exact stats that you're asking for, but I will ask our comms staff who are monitoring this to see if we can get those numbers out of AHS as soon as possible. I can further report on that we are considering, and we're taking a look at the decision by the Centers for Disease Control in the United States yesterday to relax, or to, I should say, modify isolation requirements. They went from a standard of 10 to 5 days, and so we're looking at that. We're looking at what other jurisdictions are doing to address this issue. And I don't know, Dr. Hinshaw, if you'd like to add anything to this.
Just to say that we are looking at essential service maintenance, and the fact that with Omicron spreading as fast as it is, there may be additional things that we need to adjust in our isolation orders to be able to ensure that essential services can continue, and conversations are happening about that this week.
Thank you, Dr. Hinshaw and Premier. Dawn, do you have a follow-up today?
Yes, I just wonder, we didn't quite get to the point about allowing people who are actually infected, tested positive and infected, actually suffering from the disease, to treat people who are suffering from the disease. That's one of the points of the Quebec thing.
Yeah, that's clearly not our policy in Alberta at this time, and I will just only say that I will take seriously any future advice that we get from our public health advisors, as well as the people responsible for administering the hospitals. Right now, that kind of protocol that Quebec has gone to is not necessary in Alberta, but I don't think we can completely rule out that if our hospitals were under the most extreme kind of pressure, that we would have to modify the self-isolation requirements to maximize the workforce. But that is not something that's under active consideration with respect to people who are currently infected in Alberta in the healthcare workforce. So we have a 10-day isolation requirement. That is the rule that we have right now. If somebody tests positive or is infectious and they have been vaccinated, and by the way, I think 97% of the AHS workforce is vaccinated, then they have to observe the 10-day isolation requirement. That's the current policy. If there's any change, we'll of course let you know.
Thanks, Premier. Operator, can you please connect our next call?
Jason Fedor, CTV.
This is for Dr. Hinshaw. Doctor, of course, you mentioned it's going to be about a month until we see hospital numbers for this giant wave that we're seeing right now of Omicron. But it's been almost 1 month since we saw the first case of Omicron detected here in the province. So since then, I'm going to make it very simple. How many people are in hospital currently or have been in hospital with Omicron, and how many have died?
I don't have, as I mentioned earlier, the most recent statistics on people who have died in the last several days, so since we reported on the 23rd. So it's possible that there could have been some deaths from Omicron in that time period. It has been reported to me that there have been 12 hospitalizations for Omicron infections. However, I don't know how many of those are currently in hospital, and that was an estimate from a few days ago. We don't currently have the breakdown of hospitalizations by different variants. So it's really important to remember that that the highest risk of having severe outcomes is in those who are older, and those who are part of the early wave of Omicron in the province were predominantly those who were younger or highest risk in the 20 to 39-year-old age group in terms of the group that had most of the early Omicron cases. So all of those are reasons why we wouldn't expect to see a significant impact of Omicron in hospitals for several weeks yet, and that the fact that it's relatively small numbers to date is not a guarantee of what we will or won't see in the future.
Thank you, Dr. Hinshaw. Tyson, do you have a follow-up today?
Yeah, just a quick follow-up. I know, of course, those numbers aren't finalized, as you mentioned earlier, but of course, we don't know the actual numbers when it comes to rapid tests, things like that. So do you actually think these numbers are higher in the province? Do you have kind of an indicator? Maybe they're 4 times higher, 8 times higher, an indication at this point of how many people are testing positive?
We know from previous waves that our PCR testing program was capturing about 1 in 4 of the actual cases based on our serial serology sampling that we do. That increased, or I should say the proportion changed slightly, and in the 4th wave, we anticipate that we were catching about 1 in 6 of our actual cases with our PCR testing program. Again, there are many people who, for various reasons, don't seek testing when they're sick. And with the shift to making rapid tests available, I would anticipate that the PCR tests that we are currently reporting as positive, again, are just the tip of the iceberg, and it would be expected that the total number of people who actually have Omicron would be much greater than is currently captured in our numbers, again, because we're going from that baseline of about 1 in 6 previously, and it would be a smaller proportion we're capturing in PCR with this change to use rapid tests, as other provinces have done, to be able to manage the significant surge and focus our testing capacity on those who need that PCR test to either manage their clinical care or help to manage outbreaks in high-risk settings.
Okay, thank you, Dr. Hinshaw. Operator, can you please connect our next call?
Jackie Wilson, Global News.
Hi. I just have one question and then a follow-up. First, this one can be for the Premier, the first one. So only 34% of kids ages 5 to 11 have had their first dose. So I'm wondering what the province is doing to help protect kids around those age groups, kind of 17 and under. Are you considering boosters for 12 to 17-year-olds or postponing school?
Thank you for the question, Jackie. First of all, I understand that our vaccination rate for 5 to 11-year-olds is roughly in line with the rest of Canada, so I don't think Alberta is an outlier in that respect. Secondly, on the question of booster shots, that has not been presented to me as something that is under active consideration. Boosters have been recommended by both the national and the provincial advisory committees on immunization for the adult population. So I'm not aware, and I defer to Dr. Hinshaw, I'm not aware of any discussions internally about expanding that to adolescents. I would point out that of course, you know, we've had much lower severe outcomes from children and adolescents than adults. We have experienced in the last 22 months one COVID-related fatality for somebody under the age of 18 and much lower levels of hospitalization. Of course, every case is a concern, but there has to be a risk assessment done, and we rely on our scientific advisors to provide us with that advice. Thirdly, on the question of schools, we are discussing that within the government. We're looking at what other jurisdictions are doing in terms of the plan forward. It's clearly our strong preference to maintain as much as possible in classroom instruction. We think it's very important for the mental and emotional well-being of children and for their lifetime learning opportunities, to maintain that stability within classroom instruction to the greatest extent possible. That's what we've sought to do in Alberta. And suspending in classroom instruction has always been one of the very last things that we've wanted to do. We also know from the data that in-class transmission has not been a major source of community transmission in Alberta or elsewhere. Now, having said that, with the very rapid spread of Omicron, we can expect that the outbreak protocols that we've had to date will likely become obsolete very quickly, and that many teachers and staff may be in isolation. So we are looking very carefully at all of those factors, and we'll be making a decision later this week about how best to proceed.
And Jackie, do you have a follow-up?
I did, thank you. This one is for Dr. Hinshaw. It's just a clarification. On the provincial website, it classifies schools as a high-risk setting, saying that teachers and students should get their PCR test. But you just mentioned that children with no medical risk factors do not need a PCR test. Would you be able to clarify that?
Absolutely, and we are working to update the website. This is how fast things are changing with Omicron. When we made the change last week, we were following protocols for a particular number of new cases a day, which were still enabling us to be following up on school-aged kids and those in daycares. However, with the surge in numbers and the volumes that we're currently seeing, it's not possible to maintain those individual follow-up notifications, and we expect numbers to rise much more within the next several weeks. So that protocol has been altered because we do need to focus our capacity on those, again, where there is the highest risk of severe outcomes. And so at this point in time, again, that website update needs to happen. It refers to the policy last week when the cases were at a manageable volume to be able to maintain those calls. At this point, it is not possible to continue those calls, as people who are doing the work of follow-up need to be directing their activities towards those highest risk settings of continuing care, acute care, and some other congregate living settings. And that's why the change has been made.
Thank you, Dr. Hinshaw. Operator, can you please connect our next call?
Thank you. Graham Thompson, iPolitics.
Thank you. Question for the Premier. Sir, you were talking about the 10 million rapid tests that you've bought and will be arriving, I guess, early in the new year. A question, so do you want the federal government to send Alberta more testing kits, or do you want the federal government to simply approve different kinds of testing kits that a province like Alberta could then purchase?
Thanks, Graham. The answer is we would like the federal government to do both. The federal government had committed to the provinces several months ago that they would procure the rapid test kits for the provinces, and they entered into a number of contracts to do so. But and they kept suggesting that there was as much supply as we could need. But when we came into the fourth wave, we found that was not the case, that we were not getting the supply that we wanted for widespread distribution. And so that's why we've decided to proceed with our own direct procurement, I should say, in addition to and to complement federal distribution. So the 10 million tests that we have ordered, the first million of which have arrived, it would be in addition to an anticipated arrival of several million federally sourced kits. So it's going to be both provincial and federal procurement. But more broadly, we do renew our call on the Health Canada to accelerate the approval of rapid test kits. As I pointed out in the past, we have fewer than 10 products that have been approved by Health Canada for use in Canada, but there are, I believe, over 60 that are available in Europe, including many which are much more user-friendly. And I understand that the Food and Drug Administration just recently published a new protocol or process that to accelerate the approval of rapid test kits to address the same problem, the same bottleneck. If I could ask our communication staff to please get Graham a copy of the letter that Minister Copping signed with his 12 provincial and territorial colleagues to the Federal Minister of Health in November, I believe, specifically calling on Health Canada to accelerate the approval of rapid test kits so we can have more providers and therefore more supply.
And Graham, do you have a follow-up today?
Yes, I do. Thank you, Premier. So, and the bigger picture about the response to the pandemic, of course, you faced a lot of criticism from both sides. One of your loudest critics has been Brian Jean. He is now apparently he won the UCP nomination. So what do you make of him being the UCP nominee for the Fort McMurray yet to be called by-election when his campaign is basically to campaign against you?
Well, my focus is on this immediate threat to our healthcare system, not internal party politics, Graham. We are facing a global challenge with this Omicron variant spreading at unprecedented speed. And if this runs out of control, it has the very real possibility of threatening the capacity of our healthcare system. As I said to my party's AGM last month, I will not allow our healthcare system to be put in a position where we're denying people critical care. And so all of my time and attention is focused on that challenge. And then, of course, more broadly, the challenge of economic recovery. And I'll just say, it's in a crisis, when you're dealing with multiple crises, it's a lot harder to lead and manage through those crises than to sit on the sidelines lobbing criticism.
Okay, thank you, Premier. We have time for about 2 more calls today. Operator, can you please put through our second last caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. I want to build on Don Braid's initial question about Quebec and the new protocols for healthcare workers. Do you anticipate that Alberta will have to change its existing protocols?
I've received no advice to suggest that, but we are looking at broadly changing protocols with respect to self-isolation for vaccinated individuals, including for healthcare workers. And I can foresee a situation if we were under extreme stress with respect to the ability to provide care, with a huge percentage of the healthcare workforce on isolation. I can imagine a situation where healthcare administrators, in consultation with our public health authorities, would do a risk assessment of when and where it's appropriate to call people back to work. And I don't know, Dr. Hinshaw, if you'd like to add to that.
I would just say that, again, what we anticipate will happen here. We see what Quebec and Ontario are experiencing. They are several weeks ahead of us. We need to be ready for those eventualities. Healthcare is one of those essential service settings, and there are also others, essential infrastructure that must be maintained and operated. So we are looking at multiple options in terms of how we could facilitate the continuation of essential and critical services, while at the same time protecting public health and minimizing the chance for COVID to spread. But this is the reality of Omicron. It is the reality that other provinces are facing. And so we are looking at options to prepare in the eventuality that we're going to be facing the same thing in several weeks' time.
Thank you. Carrie, did you have a follow-up today?
Yes, thank you. Premier, you had just mentioned that you were looking at changing the advice for vaccinated people. Can you give us a little bit of an idea of what you're looking at?
Well, we are discussing and receiving advice on possible modification to the self-isolation protocol, both broadly for the population and more specifically for essential workers, in line with what other provinces have been doing. I believe one other province has announced a moving from a 10 to a 7-day isolation period for vaccinated individuals. I note that the United States Center for Disease Control has moved its general advice from a 10 to a 5-day period of isolation. No final decisions have been made. This is under active review, and we may be making a decision on this later this week. Dr. Hinshaw, would you like to add anything to that?
No, I think that covers it. Thank you.
All right. Thank you. Operator, can you please connect our last call of the day?
Thank you, Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. I'm wondering, testing has been scaled back last week, and I know that the government has been encouraging rapid antigen testing. What advice would you give to workers who are relying on RATs, should they need to access time off work or disability, not having a PCR test to get that kind of support? What is the government going to do about that?
I'll refer that to Dr. Hinshaw.
So we've had questions about, for example, those who have COVID, who test positive on a rapid test, and then who go on to develop long COVID symptoms. You're raising some other issues about workplace challenges. We know that these are challenges that are being faced in all provinces. All provinces have gotten to the point where we are not able to, or the majority of provinces, I should say, have gotten to the point where we are not able to continue to offer PCR to all Albertans who have even mild symptoms. So these are challenges that we're working through. Omicron has moved very fast, much faster than any previous variant we have ever dealt with. And so these are the kinds of things that are being considered, and we hope to have an approach to those soon, again, looking at other provinces and working together to determine what are the solutions that have been most effective elsewhere, especially those places that have had to move earlier than we have. And so again, needing to balance the speed of a response to Omicron, where we were having challenges meeting the appropriate turnaround times for PCR testing, for example, for those who need that result to inform immediate clinical care, over and against some of those longer term implications. And so those are the kinds of things that are being discussed. And when we have ways of documenting rapid tests to address some of these issues, we will let Albertans know. In the meantime, it's prudent for Albertans who test positive on a rapid test who have symptoms and who are not in one of those high risk categories those individuals, it would be prudent for them to notify their primary care practitioner so that it's on file for them that they have had this positive test with symptoms. And that's one way of documenting it in the short term as we work through some of these details.
Thank you, Dr. Hinshaw. Lisa, do you have a follow-up to wrap things up today?
Yeah, thanks, Harrison. I'm wondering, I mean, the accessibility of PCR tests has been scaled back. That was a political decision. I think this question is for Premier Kenney. Can you scale that back up given the demand we're seeing right now and given this exponential growth? I mean, can you scale that testing back up? Really,
well, Lisa, sorry, go ahead. I think I got the question there. Well, Lisa, first of all, it was not a political decision. We have been a leader in Canada in the volume of our PCR testing since the beginning of COVID-19. We've typically been at or near the top of the country in terms of per capita administration of PCR tests. That is certainly that continues to be the case, at least with respect to Western Canada. But there's still a limit. We can push it to maybe 18,000 tests a day. This would be, even at that, running at full out, at total maximum capacity, running our staff ragged, working around the clock, massive overtime for a workforce in our labs that has already been under enormous pressure. Doing that, we still would not be able to nearly keep up with the volume of testing demand that would be imposed by widespread Omicron transmission. So this is the reality that jurisdictions all around the world are facing. And so we received advice, as have other governments in Canada, that we should increasingly focus the testing on higher risk populations. And as Dr. Hinshaw said at the beginning of this, to encourage people to assume that if they have cold-like symptoms, that they are likely positive with the Omicron variant. Let me be absolutely clear about one point. This has nothing whatsoever to do with cheaping out on testing. We have, as you know, put aside nearly $3 billion in COVID contingency funding in the fiscal framework for both the budget last year and this year. And we have made it, I and Cabinet have made it very clear that we want to go big on testing. We've seen it as an important part of our COVID response, that if additional resources were necessary, we would have provided it. But I have to say that I'm getting reports that our lab staff, our brilliant, hardworking laboratory staff have been working some inhuman hours for much of the last 22 months. And there's only so far you can push a workforce like that. We've expanded the capacity. We've done everything we can to procure supplies, reagent, and other necessary equipment. But at the end of the day, there are limits. And when you're facing what looks like almost unlimited transmission right now with Omicron, we have to make choices. Doctor, would you like to add to that at all?
I think just to emphasize that this is something that every jurisdiction in Canada is grappling with, and we certainly weren't the first to shift to use of rapid tests for confirmation in those for whom the outcome of their treatment is not going to be affected. And we know other provinces have had to go even further, unfortunately, and really limit PCR access to only a smaller group of people, whether or not others have access to rapid tests. So these are difficult decisions, and certainly in terms of our ability to manage Omicron, this is spreading so fast and so far that individual case management will not substantially halt the spread. We must be taking proactive measures every day in every aspect of our lives because we should be assuming that there's someone with Omicron infectious in any public place we might be going into right now. We should just be making that assumption and taking appropriate actions accordingly, because again, this is just a very different variant than anything we have faced before, requiring, unfortunately, very difficult choices.
If I could maybe just add one more point, sorry, Harrison, which is that we continue to have good data available to us to assess COVID transmission on a population basis through the wastewater treatment program that is jointly administered by the Universities of Alberta and Calgary, together with Alberta Health. And we've invested significantly in that program, stepped it up in the number of locations where we take samples. So that's an additional relevant data point that helps us to identify the scope of transmission at a population level.
Thanks, Premier. That wraps things up today.